Hi, I'm Dr. Jeffrey Payne from Payne Chiropractic Center. I want to talk to you a little bit today about carpal tunnel. Carpal tunnel is a big buzzword in computer industry, manufacturing industry, and we see a lot of people that have been diagnosed with it. But often the diagnosis is incorrect. And carpal tunnel, what it means is the carpal bones, there's 8 of them, which form a round, like upside down U in your wrist. And there's fascia or connective tissue that goes over that. And all the muscles that control your fingers, most of them, not all of them, but most of the muscles that control your fingers and your grip strength are here in your forearm. The tendons go through that tunnel as well as the nerves. If you have your wrist in a bad position or an awkward position, not a neutral position, sleeping at night or while you're typing or something like that, you can scrape on that connective tissue and it swells up. That's carpal tunnel. It starts putting pressure on the nerves, you get numbness, tingling in your hands and such. Now, sometimes something can mimic, and it's very often, pressure on the neck and damage to the neck can put pressure on the nerves up here that come all the way down and go all the way into the hand. Now that can mimic carpal tunnel. A quick way for you to tell the difference between the two is if you have carpal tunnel, this should be tender. When you push on that wrist, it should hurt. And when you do this, your hand should show the symptoms, whether it's numbness, tingling, or pain. And you hold it there for any period of time. So the carpal tunnel right here, a lot of times is not the culprit. So what we do is we check the neck and make sure these joints are moving properly. We check the wrist and make sure those carpal bones are moving properly. And even when it is genuine carpal tunnel, sometimes it's just that those joints in the wrist aren't moving properly. We're able to adjust those joints, get them moving again, adjust the neck joints up here, get them moving again, decrease the swelling because there's natural motion in the joints again, and all of a sudden we don't have the symptoms. We saved a lot of people from surgery. It's always worth a try. If you've got any symptoms of carpal tunnel or been diagnosed with it, come on in. New patients, examine x-rays are on us. We'll take a look at it. Sometimes we've got to say, oh yeah, it really is, and we're going to have to refer you to surgery. But it's a good amount of time that we can help without that. I'd say 75% of the time. So if you need us, come see us. Thanks for listening.